we're going to be talking about how to strengthen your knees today. I know that our knees are really a complex joint in our body. They're very mobile and they take a lot of pressure and exertion on that particular joint. So it's really important that we take certain steps to strengthen our knees and to really put our joint health as a priority. Knee pain is a common complaint that affects people of all ages, and it may be the result of an injury such as a ruptured ligament or torn cartilage, or medical conditions including arthritis, gout, or infections can also cause that knee pain. Knee arthritis are two different types of arthritis that can affect the knee joint. The two top ones are osteoarthritis and rheumatoid arthritis. Knee osteoarthritis is something that happens more after some wear and tear on your joint versus rheumatoid arthritis, which is more of an immune deficiency disease that can also affect that joint. You can also really experience knee pain from knee ligament injuries, such as a torn knee cartilage or tearing of the meniscus is a common cause of knee pain as well. Another common cause of knee pain is going to be any kind of infection in your knee. Infection causes inflammation, swelling, and therefore really is very, very painful. So that could be another cause. Associated symptoms with this knee pain, well, besides just the pain, is your doctor is going to actually ask you whether you have noticed any swelling or experienced symptoms like fever or chills, which would be signs of a potential infection, or other whole body symptoms like joint aches, fatigue, or unexplained weight loss, which could indicate a systematic disease like rheumatoid arthritis. When you're looking to really strengthen your knees, it is really important to understand the root of maybe where some pain is coming from. And so if you really take these certain steps to help strengthen that knee, you'll really not only help cut down on that pain, but prevent future pain and prevent future injuries to continue to happen. Let's take a look now on actually how we're going to strengthen our knees. The first two are pretty simple, and it's going to be rest and ice. If this is going to be if you need to strengthen your knees, but it's coming out of an injury or some type of trauma to the knee, it's really important that you rest your knee, that you have put ice compressions on the knee. That way you're making sure that you are ready to go to begin strengthening that knee back up. Another great way to strengthen that knee after the injury or after any kind of trauma or anything like that, or just normal wear and tear, is going to be to go seek out help from maybe a physical therapist. Physical therapists will really give you guided movements, guided exercises to really help strengthen your knees. Also, they might suggest something like a support brace or something of that nature. Medications are also something you could look into, whether it be something prescribed from your doctor or just an over-the-counter pain reliever like an ibuprofen or an Advil, something of that nature. But again, those medications over the counter are more of a band-aid fix. They're really going to help relieve that pain, but not going to necessarily strengthen the knees or not going to cure any serious problems. Injections are another way that you could combat that. It's a little bit more invasive treatment, but it is an option if your pain is chronic, if it persists. Your doctor may guide you to that solution. And finally, a TENS unit is another great way to help relieve pain and to help strengthen the knees. TENS unit uses electrotherapy to really kind of redirect how our brain perceives the pain, and also to create lots of endorphins in our body, which just makes you feel really great just in general, and also it really helps to get your strength back when you have those endorphins, which are our body's natural painkiller.